Hello everyone, it's Paul. Let's have a look at malignancies in urine specimens, urothelial carcinoma. So low-grade tumours, remember, have very little nuclear atypia. It's really an architectural diagnosis based around finding papillary groups like this with fibrovascular cores that look like a branching coral. So this aqua blue stuff, that is the stromal tissue, and there'll be blood vessels in there. And then palisading off the edges of those groups are fairly bland urothelial cells. And so because the epithelium lining these tumours is virtually benign in appearance, we really can't diagnose it unless we see these large groupings. So you can see this long strip here that's branching, has a fibrovascular core too, but notice the extreme cellularity of this specimen. So papillary lesions anywhere in the body are probably the most cellular specimens we see. Let's have a look at high grade. This is the focus of urine cytology, and this is a typical high grade field. There is quite a bit of degeneration in some of these cells here, but we've got as well some really obvious malignant looking nuclear chromatin. Here you can see very high NC ratio cells, kind of coarse chromatin. Some mostly round, but some irregularities of the nuclear membrane. And when they're well preserved, they'll have quite prominent nucleoli. But very high NC, so these are like, I suppose, the same NC ratio as a high SIL cell. You also see groups, and here's a typical urothelial cell carcinoma group. It looks disorganised and hyperchromatic at this power, and you can see there's overlapping of nuclei in the central areas and quite coarse chromatin, variation in size and shape. So this is a fairly easy diagnosis of urothelial carcinoma. Here's another group, again looks just like a crowded hyperchromatic group from high-grade SIL, except the chromatin's very coarse in these and irregularly distributed in some of them. There's a bit of apoptotic debris in amongst all of these variably sized nuclei as well. Here's another area. You can see how hyperchromatic these cells are. And this is another appearance, so they're not always supercellular. We've got some normal cells here and then just scattered malignant cells. They've got obvious nuclear abnormalities. Here's another example. This one's showing quite a lot of degeneration. Often it's a matter of driving around till you can find cells that are well enough preserved for you to be reasonably sure that you're dealing with a malignancy, not just degeneration. There's some really angular looking nuclei in here and a lot of variation. So quite happy this is high-grade urothelial carcinoma. And when they're well preserved, these tumours can show really fantastic examples of abnormal nuclei. So here you can see really well preserved abnormal urothelial cells with irregular chromatin, prominent nucleoli and variation in size. And so in summary, with low-grade tumours, we have very poor sensitivity because there's a lack of nuclear atypia, and the only time we would diagnose them is if we see fibrovascular cord papillary groupings of cells, and in urine cytology that's extremely rare. So our focus really is on high-grade lesions, and these look a bit like malignant versions of high-grade SIL. So they appear in crowded groups as single cells. They have very high NC ratio often. Sometimes they have an eccentrically placed nucleus that gives them a bit of a plasmacytoid appearance. They generally show really good coarse irregular chromatin pattern, variation in size and shape of nuclei, and often sort of superimposed on that is a degenerative change from sitting in the urine. And when they're well preserved, you often see quite prominent multiple nucleoli present.